Are you and your partner dreaming of welcoming a little one into your lives? Before you take that exciting leap, let's make sure that your bodies are well prepared for this exciting journey. So, hello everyone, I'm Dr. Anjali Kumar. I once again welcome you to Maitri. Maitri is a space where we talk anything and everything about women's health. So, welcome yet again to one important video in our fertility series. Preconception tests are your first step to ensure a healthy start for your baby. They're like a health checklist for both the partners, helping you ensure a smooth and healthy pregnancy. So today, let me break it down and simplify it for you. And remember, this is not an exhaustive list. Preconception planning involves detailed history, examination by a doctor, the required blood tests, supplements, and most important, positive lifestyle changes. So first, let's start with women. Number 1, complete blood count. What is it? It checks overall health, anemia, and infection. Why should you do it? A healthy hemoglobin level ensures proper oxygen supply to the baby. Normal values, hemoglobin 12 to 15 grams per deciliter. Second, blood group and Rh typing. What is it? It determines the blood type and Rh factor. Why should you do it? Incompatibilities between the partners' Rh factors can lead to complications. So focus. Rh negative, please check your partner's blood group. You may need an anti-D injection during pregnancy and after delivery in case your baby is Rh positive. Third, thyroid function test, T3, T4 and TSH. What is it? It checks thyroid hormone levels. Why should you do it? An imbalanced thyroid can affect the ovulation and fetal development. Normal values for TSH, 0.4 to 4 milli international units per liter. Very important, rubella immunity test. What is it? It tests for immunity against rubella. What is rubella? It is an infection which, if happens in non-immune mothers during pregnancy, can cause serious birth defects. So what are you supposed to do? Get a test called rubella IgG to check your immune status. No immunity? Get vaccinated and wait for 1 month post-injection before trying for pregnancy. Vitamin D and folic acid levels. So what is it? It checks the levels of these vital nutrients. Why should you do it? It is essential for bone health and preventing neural tube defects in the baby. Normal values, vitamin D 20 to 50 nanograms per ml, folic acid 2 to 20 nanograms per ml. Serum AMH. Now this is anti-Mullerian hormone. So what is it? It tests your ovarian reserve, which means how many good quality eggs do you have. It indicates quantity and quality of eggs both. Best time to do this test? It can be done any day of the cycle. Normal values 1 to 4 nanomoles per liter. It is important to consider egg freezing in case the values are low and you are planning a pregnancy later. I hope you have watched our video on why are women losing their eggs faster these days. Then blood sugar test, fasting and postprandial blood sugar and HbA1c. Why should you do this test? High sugar levels can affect the fertility and can cause serious birth defects in the baby and complications during your pregnancy and delivery. Normal values, fasting blood glucose 70 to 100 milligrams per deciliter. Very important for diabetic mothers, do not plan a pregnancy till your sugars are well controlled at least 3 months preconceptually. Then, testing for thalassemia. This test is called HPLC or HB electrophoresis. So what is thalassemia? It is a genetic condition which causes anemia. It is important if both the partners carry a thalassemia gene, there is a serious risk of baby inheriting this gene from both the partners and requiring a blood transfusion regularly throughout his or her life. Remember a movie called Salam Namaste, where Preeti Zinta asked Saif Ali Khan to get his blood test done. That was for thalassemia. Genetic counseling is needed if both the partners carry a thalassemia gene. Then pelvic ultrasound. What is it? It examines the uterus, ovaries and other pelvic organs. Why should you do it? It detects fibroids, cysts or other structural abnormalities. The best time to do this test is post-menstrual. For men, semen analysis. What is it? It evaluates the sperm count, motility and morphology. Why should you do it? You obviously need a healthy sperm for fertilization. Normal values, count should be more than 15 million per ml. Motility should be more than 40% and the morphology should be more than 4% normal sperms. Best time to do? After 3 to 5 days of abstinence. Then hormonal profile, FSH, LH and testosterone. What is it? It checks the hormone levels affecting the sperm production. Why should we do it? Low testosterone or imbalanced hormones can reduce the fertility. And of course, blood group and Rh typing. Why should you do it? It ensures compatibility with the partner's Rh factor. Now coming to both the partners. Most important is STI panel, sexually transmitted infection panel. So we routinely test both the partners for HIV, hepatitis B and C and syphilis. Why should you do it? Early detection prevents transmission to the baby and further complications. In some cases, genetic carrier screening is also required. It identifies inherited conditions like thalassemia or cystic fibrosis. So getting these tests done ensures that both the partners are healthy and prepared for this life-changing journey. These simple tests give you peace of mind and prepare you for the journey ahead. Remember, a little preparation now can make all the difference later. Want to know more about preconception care? Follow our fertility series, share this video with anyone planning a pregnancy, and do not forget to like and subscribe to Maitri, and I will see you soon.